It's like translucent.
One of my concerns is that my water will break while we're not near one of the facilities that our insurance pays for. And then I don't know what happens. I mean, you go to the hospital and you get the care, obviously, but I don't know if we'll get any kind of out-of-network coverage.
Yeah. Well, I guess you should be close to home.
Yeah, you should kind of stick around. That's one concern that comes from our great healthcare system. And then the other one is that I cannot get my doctor's office because it's a giant, it's Kaiser. So, like, you can't just directly call your doctor. You call, like, the center where they are, and you, like, leave a message and hope someone forwards it to them. But then they're disconnected from the records department and so on and so forth. And I don't know who needs to tell the Washington Post's insurance company, Prudential, that I'm actually pregnant or how to get them to do that. But unless they do, I can't qualify for maternity leave.
Yeah, I mean, we'll figure it out.
So that's a struggle we're having right now. It's a great system.
Yeah, I mean, it's because maternity leave is so rare. There's no system in place for how it even's supposed to work or whatever. In my family fun pack, a pregnancy, well, you don't have a pregnancy certification required to get paid leave because, paid leave follows from birth, not from pregnancy. Though I guess you can take it ahead of it. In any case, you have a fairly central system. The baby box is provided by the Social Security Administration, and to get the baby box, the doctor will send a pregnancy certification. So that'll just happen automatically, basically, because everyone will know. Yeah, as part of being a doctor, as part of being an OB, you send a pregnancy certification to the Social Security Administration. Here, you don't. What do you know? What system? They're not connected to Prudential. There's no like contracts or anything like that. So it's like a completely ad hoc, like, oh, there's this other company that says they'll give her cash if she's pregnant. So I guess we should tell them they're pregnant. But there's like nothing. There's no law that would require them to tell them that you're pregnant. And it seems like, in fact, there are laws that might make it hard
like
for them
HIPAA.
to tell them.
And then maternity leave is such a completely hit or miss opportunity period in the United States that there's no expectation among OB-GYNs when you walk into their office that you're going to be one of the few people who qualifies for some kind of advanced maternity care leave, even in these professional class jobs.
Well, because even if you get it, there's doing it through an insurance company is also not necessarily typical.
Right. I've heard of it done several different ways. So the doctor has no clue, A, if you even qualify for it, B, what their role will be in you getting it, if they play a role in that process at all, and C, how to engage in that role. So maternity leave in the United States unfolds along these super ad hoc lines.
Totally ad hoc.
Where you're just trying to corral not only your company and whatever leave you have there, sick leave, vacation time, but also your doctor's office for some kind of verification that this is actually happening. And then your company's insurance company, which pays out the short-term disability that actually serves as maternity leave. So it's a hideous process. And I don't think that candidates who have these streamlined federal plans for parental leave or even for a single payer make enough of how much simpler and more streamlined life would be.
That's a big part, because when we think about distributing resources, we think about money, we think about wealth, we think about consumption. No one thinks about time. No one thinks about frustration or stress or whatever you want to call it. These are not quantities we think about when we're talking about distribution.
Right.
But like that's a thing that you really can. Like, you really want to talk about, you don't have to redistribute from the rich to the poor or whatever. Making it so that paid leave is a pretty much an automatic experience. The doctor sends a pregnancy certification in the background without you ever having to ask them to do that. To the central administration. When you give birth, the hospital sends a notice directly to the Social Security Administration to start paying your child allowance, to start paying your paid leave, which you've filled out forms for. Like, you can save everyone time. Everyone enormous amounts of time. If you provide child care centers, you can save everyone tons of time involved in
Right.
trying to search for care and that sort of thing. Like, it's a thing you could provide to everyone. It's
Yeah.
just time and stress reduction, separate from the actual like money redistributive aspects, which
God,
also
the
obviously are key.
doctors included. I mean, when I went in for my appointment last week, I was like, hey, I got to talk to you because my company's insurance company needs to hear from you that I'm pregnant. The doctor was like, how do I do that? I was like,
God.
I don't, I think there's a fax.
There's a fax. We're running faxes
There's
back and
supposed to
forth.
be faxes. But like, this is time out of a medical professional's day where she should just be treating
very
people.
highly valued labor. Right. This
Right.
is this is one of the things that some of the single payer advocates will get onto that sort of gets missed is they'll say, look, we talk about savings and that sort of thing, and how will the system absorb all this new demand? You know, because we're going to have
Right.
30 million more people insured. A lot of other people who are already insured don't seek care because it's still too expensive for them. So you're going to have a lot more people who want to go to the doctor, theoretically.
Yeah.
Now, some people say, no, you're not. What you're going to have is a redistribution of people who want to go to the doctor. Rich people will go less because, you know, for this or that reason. But there's another response. It's like doctors will have a lot more time to absorb
Right.
these new patients because 20% of their day is consumed in stupid bullshit that you could get rid of in a more streamlined system. And so they can see, you know, 25% more patients than they
Right.
currently do because you get rid of that work, which
Because,
is...
yeah, right now I leave the office and my doctor, who's a great doctor, has to like try to figure out to where this fax was sent in this massive medical network building and to try to recover it and fill it out and figure out where in the massive system that is Prudential to return this fax. And it's like, yeah, man, it seems like you should just be treating people who have babies on the way.
Yes.
Honestly, you're an obstetrician.
Your time, which you had to go through 8 years of medical school and so on to get to this point, you know, in a exclusively like efficiency, almost Taylorist approach, should all go to the stuff that only you can do,
Right.
which is the doctoring. This stuff with the paperwork and stuff, you shouldn't be doing that. In fact, no one should be doing that because it should be more automatic, and we're just wasting. The professions, the capital P professions, are just full of waste.
It's horrible.
And a lot of it is because a lot of what they do is basically the sort of running of the bureaucracy, not the explicit governmental bureaucracy, but the, you know, private sector bureaucracy of managing numbers and payrolls and forms and so on. And that shit should just be able to be cut out.
Right. It just shouldn't be happening at all.